So hi everyone again. I hope my sound is okay. Right. So welcome to GODAN Action webinar on the Global Nutrition Report and Open Data. This is Ilkay Holt speaking from Food and Agriculture Organization of the UN, and I'll be moderating this session today. This webinar is organized as part of the GODAN Action e-learning course on open data management in nutrition, agriculture and land. This course has been offered to over 4,000 people in the past year, and we are happy to contribute to the community in managing and opening their data. Today we welcome Dr. Jess Fanzo, co-chair of the Global Nutrition Report Independent Expert Group. Dr. Jess Fanzo is a distinguished associate professor of ethics and global food and agriculture in the Berman Institute of Bioethics and the School of Advanced International Studies at Johns Hopkins University. In this webinar, Dr. Fanzo will discuss the benefits that open data can have for nutrition and the Global Nutrition Report. By the way, we have a great timing for this webinar because the report for 2018 was launched just yesterday. Before I hand over to Dr. Fanzo, let me tell you about some housekeeping notes. The presentation will take about 25 minutes. Please type your questions in the chat box. We will take the questions at the end of the talk, but please feel free to type them during the talk too, if you have any. This webinar is being recorded and will be made available after the event, both for the course and external participants of this webinar. And thank you so much for joining us today. Dr. Jess Fanzo, it's over to you, and thank you very much for your time today for us.
Okay, yeah, thanks to GODAN for having me, and thank you all for joining during this exciting time. We've just launched the 2018 Global Nutrition Report, which is the 5th report to come out, and this report was meant to be taking stock of data and where we are at. And I'm going to present a mixture of some of the findings from the Global Nutrition Report this year, but also more so on what are the data needs that we have? What are some of the data gaps? And you know, what do we need to do to fill those gaps? So I'm hoping that we can have a bit of a discussion around what's needed out there, beyond just the 2018 findings, but where do we really need to go to improve our information systems for nutrition? So the 2018 report, the title this year was Shining a Light to Spur Action on Nutrition. And the shining a light was really meant to looking closely at the data. What does the data show? And how can we spur on action and advocate for more attention to be drawn to nutrition? And hopefully you can all see my slides. So a little bit about the Global Nutrition Report. It's independent. It's not owned by an institution. It's not owned by a UN agency or an academic institution. It's meant to be independent, multi-stakeholder, multidisciplinary report. It's meant to highlight areas of progress and positive change, but also areas where we are falling behind. It proposes key areas for attention and action and data gaps. It takes stock annually of where we are. How are we on track for the world's nutrition at the global, regional, and country levels? And tracks, are we on track to meet nutrition targets? And identifies issues and challenges for ending malnutrition. So these are the 5 reports, the themes that we've had since 2014, which some of you may know. Lawrence Haddad, now the World Food Prize winner, led the report for the first 3 years, where it really focused on actions and accountability. And then the last 2 years, myself and Corinna Hawks co-chaired the report. And last year we focused really on what does nutrition mean for the Sustainable Development Goals, the SDGs, and this year's report on Shining a Light. So we've asked a lot of people, what does the Global Nutrition Report mean to them? And what is it? What is it? What's it symbolic of? And I think most people would say that the GNR is independent. It's put together by an independent expert group, and that group, they really leave their organizations and institutions at the door, and they sit together as experts in their field. It's global. It's meant to have a global reach within the nutrition community, but also outside the nutrition community. It attempts to highlight the burden of all forms of malnutrition. It's data driven, and it encourages accountability. So what does it track? It tracks global progress towards nutrition targets, which I'll talk about a bit more when I show you the data, country progress towards those targets, the prevalence, trends, distribution, disaggregation of malnutrition across different regions and countries, the coverage of nutrition actions and underlying determinants, financial investments towards addressing malnutrition in all its forms, and nutrition for growth commitments, political programmatic commitments. Hopefully some of you have already downloaded this year's report, but if you were to go to the website, you will see a brand new, refreshed, beautiful website where you can download any figure in the report. You can download all the data, and we have updated country profile snapshots that you can download. We've got the world country profile, we've got regional, we have sub-regional, and we have country profiles. They used to be 2 pages, but now they're 4 pages. We've added a lot more data, disaggregated data, trend data, diet data. So I think that the country profiles are a real asset to the Global Nutrition Report, and we've really tried to improve them this year and make them very accessible. We also have commitment tracking that you'll find on the website, where we track country, business, civil society, donors, UN commitments, and what they're actually doing with those commitments, and are they on track to reach their said goals. You can find that as well on the website. Every year we call for very similar things, and in one sense you could say that we keep making the same calls. It's a bit depressing because the burden is still incredibly high, but we make the same calls because it's a consistent message, and we hope it gets delivered to policymakers. But we make calls to get on track to reach global targets. We talk about how every country, not just low-income countries, not just high-income countries, every country needs to be held accountable towards reaching those global targets. We need smart, specific, measurable, achievable, relevant, and timely commitments. We need more and bolder investments, and we need really better data, better tracking data, filling the gaps, etc. Some of the gaps that we've had over the last few years are quite vast. I've listed some of them here. We've got big data gaps around diets, different vulnerable populations, food environment data, micronutrient status data, coverage data. And we also have still research gaps where we still don't know the links between certain outcomes, or food system outcomes, or health system outcomes, and nutrition. So we still have significant data and research gaps that we try to highlight every year and really make a call to action to fill those gaps. We also make a call to action to ensure that no one's left behind. And we really did this in the 2017 report, where we use the Sustainable Development Goal platform to really ensure that no one is left behind. And the best way to do that is to disaggregate data, disaggregate by socioeconomic and demographic characteristics, disaggregation by specific populations, spatial disaggregation, to ensure that we know who is malnourished, where they are, and why. And we also call for using data better, not only creating and collecting data, but analyzing that data, interpreting that data in a timely way, and making decisions based on the data that's being received. So these are kind of our core things that we call for, and the values that the Global Nutrition Report tries to highlight year in and year out. So how are we doing this year? Well, malnutrition remains unacceptably high and affects every country in the world. But at the same time, because there is an increased attention being drawn to nutrition, because the burden is so high, we have an incredible opportunity to do something about it. So what are some of the findings that we found? Well, the burden is unacceptable, and there's really been quite slow progress. If you look at stunting from 2000 to 2017, we've seen stunting come down from 198 million children to 151 million children. While there has been a decline, it's much too slow. And at the same time, we see children who are overweight, children under 5 who are overweight, is going up. So while stunting is slowly coming down, overweight among children under 5 is going up. The most significant declines in stunting have been in Asia, particularly China, Latin America, and the Caribbean. But we have new innovations on geospatial data that shows there's a lot of variability in the declines in stunting within countries. This was a study that the Global Burden of Disease folks at University of Washington did, published in Nature, and we highlight it in this year's report, showing you by very sub-national geospatial data, they look at the burdens of stunting and show the declines over time. And here you see from 2000, you see the bright dark red is high burdens of stunting, so up to 50%. And if you toggle through time, you see in some places things are improving in Africa, but there's still other places where we still are not making much progress. So the variability in the declines in stunting, really, you can see these at the subnational level. And that's why it's so important for us to get this more sophisticated subnational data. When we look at those targets that I talked about earlier, the World Health Assembly targets for 2025 and the global non-communicable disease targets, only 48% of countries are on track to reach one nutrition target. And that's pretty depressing. And of those targets, the most progress has been made on exclusive breastfeeding. The other targets were very far off the mark, particularly the non-communicable disease and obesity targets. So here is where we are of looking at all of the countries we have data for, those that are on course to meet the maternal, infant, and young child nutrition targets and the nutrition-related NCD targets. On course is the darker blue, some progress is the light blue, orange is no progress or worsening, and the gray is no data. And just looking first at the no data, there's a lot of countries that are not even keeping track of the maternal, infant, and young child nutrition targets. Pretty incredible. You see this huge gap. No one's even tracking it. And a lot of these countries are middle and high income countries that aren't tracking, like the United States doesn't track stunting, but it's a bit naive to think that the United States doesn't have any stunting when we have big pockets of poverty still. Almost all countries are off track for anemia, obesity in men and women, and diabetes in men and women. And this is really pretty alarming to see this orange lit up for the NCDs. Stunting, while there's been reductions, is also off track to meet the 2025 goal, which is about 100 million children, which is still far too many children to be stunted. But by 2025, that was the target, and it's estimated that we're only going to be at 130 million children if current trends continue and there's not an increased investment or stepping up of commitments to really get those stunting numbers down in a faster way. So we're off track even on the indicator where we are seeing some progress. And adult overweight and obesity continues to rise. I mean, look at these figures from 2000 to 2016, women be having a higher burden of obesity in this case, going from 10 to 15% over the last 15 years. And we've seen almost a doubling of obesity. And this is really alarming. And where we're really seeing these increases is middle and low income countries. 88% of countries face overlapping burdens. In the middle here, you see 41 countries that face a triple burden of women who are overweight, children who are stunted, and women who are anemic. And many other countries face double burdens of overweight and anemia, overweight and stunting, anemia and stunting of the 141 countries that were tracked. Beyond just looking at the countries, we also looked at data of children who simultaneously have double burdens. We found that globally, about 16 million children are both stunted and wasted at the same time. And about 8 million children are stunted and overweight. These burdens, these multiple burdens, make it incredibly complicated for countries to figure out how to act and what are the best interventions when you're facing these complex biological outcomes in one child or in a household or in a country. So I'm going to just hone in on diets a little bit. Interestingly, in the Global Nutrition Report, we never really tracked diets before. And diets, we know, are a big risk factor of this massive burden. But this year, for the first time, we have a whole chapter dedicated to diets. And, when we think about diets, I think about these 7 questions that we really need to understand. What are people eating around the world? What's the quality and diversity of what they're eating? How much does it cost? Where do people get their food? Where do they get their diets from? Are they growing it? Are they buying it in informal markets, wet markets, supermarkets, hypermarkets, food aid? How do people make decisions about what to eat? Are their decisions vast, or do they have limited decisions? Are their diets impacting their health in a negative or positive way? And are our diets impacting the environment? Are they sustainable in positive and negative ways? We are starting to get answers to all of these 7 questions, but it's limited. And this year we present some data. Again, there's limitations, but that starts to get at some of these questions. This is data on infant and young child feeding, their diets, which we include breastfeeding, of course, as an important diet for a child in the early years of life. And what we show is by looking at these suite of indicators that UNICEF collects, we look across wealth quintiles from lowest to highest. And basically, there's not a huge difference in wealth and the improvements in infant and young child feeding practices. Look at exclusive breastfeeding down here. There's not much of a difference between the wealthy and the poor. Same with rural and urban. There's not huge differences in these practices of children getting a minimum acceptable diet, exclusive breastfeeding, etc. So diets of infants and young children are suboptimal everywhere. which is an important finding when you start to look at this disaggregated data. We also know that infant formula sales is increased in different regions throughout the world. You look at Europe, you see infant formula increasing, Asia, Latin America, Africa, and globally. So there is some concerns over the replacement of formula over exclusive breastfeeding. And this trend is quite alarming to see. We also looked at what adults are eating. And this is a graph showing you the risk of dietary factors. So let me walk you through this. This is from the Global Burden of Disease Project, which is, again, at the University of Washington. And the data set's limited in that it does collect national dietary intake data, but it also models some data. And what it shows you is that it uses this TMREL, the theoretical minimum risk exposure level. It's an intake level of a food that minimizes the risk of death from all causes. So when you look at this middle line here, this is the midpoint of risk factor. And you can either be above it or below it. So take, for example, looking at all wealth quintiles around the world, no one is getting enough nuts and seeds. No one is getting enough fruits, whole grains, polyunsaturated fats, vegetables. What people everywhere are getting too much of is salt and and sugar-sweetened beverages. There's a bit of a mixed story, probably not surprisingly for a lot of you, about meat. In high-income countries, you see a lot of red meat consumption. Same with processed meat, whereas low-income countries and low-middle-income countries get less meat. It's expensive. Access to that meat is difficult. So you do see some differences in wealth, but overall, when you look at this, no income group is eating enough fruits and vegetables, whole grains and legumes, and eating way too much salt and way too much sugar-sweetened beverages. And what does that mean? Well, now diets have become one of the leading risk factors of disability and death in the world. And people are no longer dying of communicable diseases, infectious diseases. They're dying of non-communicable diseases, particularly heart disease, diabetes, some cancers. And what we see is that these diets are those that are low in whole grains, fruits, nuts, seeds, vegetables, omega-3 fatty acids, fiber, and legumes, and higher in processed meats, real meats, sugar-sweetened beverages. But what we really show is that a diet that's low in healthy foods puts you at more of a risk factor than the consumption of unhealthy foods. So getting that suboptimal diet has a higher disability and higher mortality. And this is a really important finding, showing that diets are not healthy around the world, and they're really causing sickness and disease and death. We also looked at school-age children, ages 10 to 19-year-olds, and looked at their consumption of different foods. And we show that looking at fruit, vegetable, and soda intake in different regions, this is the percentage of children who get fruit each day, or vegetables, or drink soda. So we really see this trend of this increasing amount of soda. 59% of school-age children are drinking soda every day. We also see that packaged food being ready meals, sweet biscuits and snacks, confectionery, ice creams, instant noodles, these very processed packaged foods are on the rise in many places, particularly in low and middle income countries. We're seeing this rise in Latin America, Africa. Globally, we're seeing this trend in the rise in sales of processed and packaged foods. But there is progress. We're seeing more countries have mandatory fortification to fill micronutrient gaps. 86 countries now have one type of cereal grain that's fortified with iron or folic acid. Only 19 countries are still classified with insufficient iodine intake. That's a great success story versus 110 countries 2 decades ago. Governments are acting to improve diets, doing things through regulation and taxes. 59 countries have imposed taxes on sugar-sweetened beverages. Multi-sector action is growing in cities. They're trying to address the obesity and poor diets in many places. And we're seeing community-based interventions make impacts, improving diets, things like Alive and Thrive, improving behavior change. We're seeing a lot of success stories. They just need to be highlighted, scaled, and transferred to other settings. And the growth in dietary data is incredible. We're seeing the Global Dietary Database out of Tufts, Global Burden of Disease Study and out of University of Washington. FAO has the GIFT platform, the Gallup Dietary Quality Worldwide Project, Index, IONDA, lots of different indices, tools, surveys to try to capture those 7 diet questions that I referred to earlier. But we still have a lot of dietary gaps. Harmonized, standardized dietary data collection and analysis is not really available. There's lots of different methodologies, representativeness, coverage, metric standardization. There's more dietary gaps in certain countries, particularly low and middle income countries, because a lot of the data is hard to collect. It's costly from not only financially but human capacity wise, and it takes a big effort to analyze that data. But we are in this world of big data. We've got Facebook, we've got Twitter, we have Instagram, we've got Amazon. These social media platforms and consumer websites are collecting so much data on consumers, their desirabilities, their aspirations, their preferences. And this is an incredible resource that we need to be thinking about, and how we can better partner with these different platforms. But there's many issues, of course, anonymized data and other things. So we need to be thinking about how do we use this big data in a thoughtful way. So these are just my last couple of slides. What impact has the global nutrition had? I think the GNR has really drawn a lot of attention to nutrition over the last year. It's been launched all over the world, many times through self-organized events as an advocacy tool. It highlights evidence-driven and best practice case studies, and it really serves as a treasure trove of nutrition information and data. It's a widely used reference. A lot of people download the country profiles and use them in their countries. And it really provides an accountability mechanism using data, looking at the commitments, looking at whether or not countries are on or off track. And it's evolved over time. It used to be much more on the undernutrition, but I would say this year is the first year we have really equally captured the overweight, obesity agenda and the undernutrition agenda. So it's inclusive of all forms of malnutrition. It's becoming more and more theme focused. We've got better financial tracking and expanded tracking of targets and improved country profiles. And I'll end there. Thank you very much. I look forward to your comments and questions.
Thank you very much, Dr. Fanzo. This was great. Yeah, the findings are really impressive, and it is amazing how you can visualize things with data, based on data, definitely. So we have some questions. Let me just read them out, and then you can actually take over. The first question came from Belay Terefe, and it says the data for the GNR were collected from different countries and organizations. How do you overcome the challenge combining data from different sources? GNR was collected from different countries.
Sorry, can you repeat that? Sorry.
Sorry, okay, I'm taking this again. The data for the GNR were collected from different countries and organizations. How do you overcome this challenge combining data from different sources?
Yeah, it's a great question. The issue is that um, the we get data. The Global Nutrition Report is a curator of data, and so we get our data usually from vetted sources like the Joint Malnutrition Estimates. We do highlight some certain research projects like the Global Burden of Disease, but it's very difficult. It's very difficult to weed out the data that is not as much agreed upon. It's also difficult to get access to data when sometimes an organization wants to share their data, but they they own that data, and so they only want us to release it at certain times, and it makes it really challenging on a yearly basis to get the report out on time when people are somewhat protective of that data. So it becomes really hard. But we almost always use the data that the Joint Malnutrition Estimates, the tracking data comes from WHO and UNICEF, and that's all been vetted through their processes. Now you can argue, is that data good? That data is coming from countries, it's being cleaned, and there's structural checks around all that data. But that's the data that we have, and we just curate that and pull it all together in one place for the GNR.
Right, that sounds quite challenging, and it must be really hard as well to create it. We have another question from John Namani. What method of data collection was adopted, technology used, and why?
Say it again. Sorry, you're cutting in and out. Sorry. Go ahead.
Sorry. What method of data collection was adopted, technology used, and why?
Well, we have a lot of different methods. Maybe I need something more specific. We really, um, I mean, the tracking data is a methodology that has been we report that every year, and that really comes from the WHO UN tracking targets, and that's been done for all countries. We talk so that is done by UNICEF, WHO, and UNICEF or in World Bank. It's done by the Technical Expert Advisory Group on Nutrition Monitoring, TEAM it's called, and that tracks the targets by setting certain cutoffs and looking at the annual rates of reduction. And there's a whole methodology of doing this, and we always put that in the report, usually in an appendix of how that data is tracked. And so, yeah, so it's quite a complex tracking mechanism of creating rules of on and off track categories for each indicator. But it really looks at the annual rate of reduction, the average annual rate of reduction, and set certain cutoff points as being on or off track.
Right, yeah, it must be difficult to explain it, simply and briefly. But again, as you say, we can actually look at the methodology in the report itself. I'm just going down on the chat box, and Sushit Anand has a question. He says, can you please share the link of the geocipitaal data series nutrition map that you showed? I don't know whether you have the link in already, but if it is in the,
Yeah,
or
I mean,
if you share it.
so the action. Do you want the slide or the article? Because the slides that a lot of the data and even more data from the 2018 report are on the website, so you can download that. Um, the paper is that map comes from is highlighted in the report. It comes from a Nature paper, and we can send the link to everybody after. I'm
Yes.
trying to look to see if I have it off the top of my head. I'm just looking in the report actually.
Okay. Okay.
It's the first author is Osgood Zimmerman. I'll type it in for everybody so they can see it. It's a great
Thank you.
paper, and it's a really important paper because it not only showed that the variability in stunting declines in Africa vary significantly depending on where you are, but also it showed that they looked to see subnationally if different subregions were going to meet the SDG target for stunting, and almost all countries were off target. Um, so I'm just putting it in now, the paper. Yeah.
Okay. So Shudo is also asking here, it might be related to that, is there a global time series map of distribution of malnutrition?
The global time series map.
Mm-hmm. Oh,
Which one was that?
I might have missed it on the slides, but maybe Sushit can just help us.
This one? This is the one paper I was just talking about. This is the one we show,
Okay.
the time series.
Okay. Maybe you can just type in, if that's not what he meant. Okay, that's great. So I'm just moving down on the other questions. Belay Trefe is asking, can stunting and overweight happen to a child same time? Please describe if yes. I think this is this is about one of the slides that you shown.
Yeah, and that was this data that we show here in that
yes, that must be it.
Yeah, so it definitely can happen. You can be stunted, overweight, and have micronutrient deficiencies. Of course, you can't be overweight and wasted, but you can be stunted and be overweight. The mechanisms of that are complex, but it does make sense in that suboptimal diets, poor immunity, all can be risk factors of both stunting and overweight obesity. Poverty being a big driver of both. And so it is very possible to be short for your age and be overweight for your age at the same time. And what makes that so challenging is what do you do about that? How do you address that early in life? And that's the complexity of getting the right kind of diet, the right kind of nutrition, without putting on weight early on in life. So it's an interesting finding. I think we're at the very tip of the iceberg of really knowing, how to deal with it, what the mechanisms are of it.
Right. We have Adomo. Adomo is asking, how can I download the materials of this webinar? As I told you, the webinar is being recorded, and I will share the links to both the recording and the slide. I'm just going down on the other questions. Iringiro, I hope I pronounced your name right. So this report, I guess you're talking about the nutrition report itself. I'll put the link in the chat box again. So Sophie Trainen is asking, it's nice to see the results, but how does it work? What do we need to do to make this work? I guess we get, the question is, we have all these findings and maybe what to do about it.
I mean, the findings are important because you can use those at the country level to try to spur action, get people to care about it, to point out where some of the burdens are in your country, and get organizations and policymakers to take action. I mean, data is meant to be shared and to then act on that data. That's what the Global Nutrition Report is all about. If we didn't present this, if there wasn't data out there, there would be no action. There would be no cause to take action. So it's meant to get people upset, that there is a huge burden, and to do something about it.
Right. Lualva, you were asking about stunting and overweight. This was already explained. Another question from Adamo. We know same diseases and genetic factors can cause stunting. Would that not confound the statistics?
Yeah, that's a longer question. I mean, really, in the first 5 years of life, at a population level, which is what these statistics capture, stunting, wasting, overweight, it's not at the individual level, it's population level data. Genetics really don't play a factor in the first few years of life. Obviously, genetics do kick in, but really, the WHO growth references, those were 8,000 children from 6 different countries: India, Ghana, US, Norway, so a range of what we would consider taller and shorter populations overall. When they mapped those 8,000 children, they were all healthy, they were breastfed in the first 5 years of life. They all grew the same. You start to see genetics play in prepubescence, puberty time. So we can really do comparisons at the population level of children who are under 5. And that's the whole point of those growth reference charts, is that we've got the normal, the reference of how a child should grow. And you can look to see if your child is growing faster or slower than that norm.
Oh, yeah. John says, he lost his connection while his question on method and technology used in the data collection was answered. I can say what we said, it was difficult to explain it briefly, but the whole methodology, it's complex actually, as Jess mentioned, and I think all the details is in the methodology within the report. Do you want to add anything, Jess, to that?
Yeah, which methodology?
Yeah.
For the tracking data?
I think just generally
I'm not sure
how
which.
you.
Yeah,
this question when it came before, like which methodology you use, which technology you use, and why in data collection.
We don't collect the data, we curate the data. The data is collected by others, and we pull it all together in one report. If we're talking about, if John's talking about the tracking of the global nutrition targets, that has a very concrete methodology that is tracked by team, which I said earlier. And there's a whole methodology around that, looking at the annual reduction rates. And if you look at this year's report, you'll find that methodology. It's quite detailed. I think it's in Appendix 1, and you can find that, of assessing country progress against those global targets.
Right, that's great. Belay is asking, how is this GNR report different to IFPRI's Global Nutrition Report?
Yeah, in Belay, there's a lot of reports out there now. There's a lot of reports capturing the same data. You've got IFPRI has an annual global food policy. They've got their global hunger index report, which is quite different and distinct in what they're collecting. You have the FAO's SOFI report, which presents a lot of the same data as the Global Nutrition Report on the burden. And you have SUN, Scaling Up Nutrition Meal Report, that also is collecting a lot of data. I still think the Global Nutrition Report is unique in that it also, beyond the burden, it looks at financing and it looks at commitments to nutrition and whether or not people are on, or countries or organizations are on or off track to meet those commitments. So I still think it has a place, but more and more we're seeing overlap amongst many reports reporting on the same data. And you could argue that this becomes incredibly difficult for countries to be reporting on data for so many different types of initiatives. So it's something to be said about trying to ensure that we're coming together and there's not redundancies.
Right. So Biringiro, I'm sorry again for the pronunciation, but it says, explain more about slide 23.
Okay. So this is showing these different indicators, these infant and young child feeding practices. So, for example, you have exclusive breastfeeding, continued breastfeeding at 1 year up to 2 years, minimum meal frequency, minimum dietary diversity of children 6 to 23 months of age, and minimum acceptable diet, which is a composite of the minimum meal frequency and minimum dietary diversity. And what it shows is that looking at the percentage of infants who get exclusively breastfed or get a minimum acceptable diet at the lowest quintiles and the wealthiest quintiles. And you can see there's not a huge difference, right? Exclusive breastfeeding, about 41% is the global average. There's not a huge difference between poor households and wealthy households of children being exclusively breastfed. And you can look across rural and urban as well, where urban households, for example, on exclusive breastfeeding, and rural households, the prevalence is quite the same of infants getting exclusively breastfed. I hope that helps.
Thank you, Jess. Sophie actually comes in with the question on where you store the data. The cloud, the web, on your computer, university. How do you make this data appear in your graphs?
Yeah, it's a good question, Sophie. So the Global Nutrition Report has a host. It used to be IFPRI. We've transitioned to a different organization the last 2 years called Development Initiatives. They store the data that's coming from different places, and they actually come up with these beautiful graphics that you see. But all of that data you can download on the Global Nutrition website. So you can take that data set, you can play with it, you can develop your own figures, you can download all these figures. But Development Initiative holds all that data and they make it publicly available on the GNR website.
Thank you. Okay, I'm just taking the last few questions. So Adomo is asking, in nutritional assessment for children, is measuring skin fold better than mid-arm circumference, or are biomedical data best, or are anthropometric data better? I'm sure you understand this much better than I do, just because.
Yeah, I think,
okay.
Adamu, I think it depends. It depends on what you're asking, right? So If you want to understand micronutrient deficiencies, the best data would be taking a blood sample, getting serum from that, and measuring the micronutrients. If you want to do a rapid assessment of children who are wasted, let's say you're working in Yemen, you could do MUAC, the mid-upper arm circumference, to get a quick assessment of wasting in the field. Very easy to do, low resource, doesn't take a lot of equipment. In standard demographic health surveys, where they're capturing that stunting data or obesity data or wasting, you would do anthropometry. You take children's heights, you take their weight, and you would take their age and months, and you'd compare those to the World Health Organization's growth references. So it really depends on what kind of data you want to capture. But stunting, the height for age, is the hallmark measure. Micronutrients, it's biochemical. Wasting or MUAC is kind of the classic indicators for looking at acute malnutrition. So it really depends on the question that you ask, but each of them answers a different question, and it's great to do all of it because you get a full picture of what's happening, as opposed to doing one type of analysis or one type of assessment.
Thank you again. Lilia has a question. She says, many thanks for the presentation and food for thought. The course we are taking now is on open data for agriculture and nutrition. Thus, my question is, which data in your opinion would best represent the link between nutrition status and agriculture output influencing the nutrition status outcomes?
Yeah, great question, Lilia. To me, the data that provides that link between nutritional status, so whether it be stunting, wasting, overweight, and agriculture would be diets. So if you're looking at agriculture interventions, probably the most relevant types of data would be what are people eating from that agriculture, from that food system. So to me, the diet is the important link. And so that is exactly why we need better dietary data. We really need to understand, what are people eating? Where are they getting their food from? How much are they paying for it? And what is influencing their decisions as when they walk into a store or they walk into a market, or if you're a smallholder farmer, what to grow. So to me, the diet is a beautiful link between agriculture and nutrition. Now, can you then, from a diet and understanding what someone is eating, be able to then say, this is why they're stunted, is because they eat poor dietary diversity? No, you can make associations, but maybe not completely causal. There could be multiple reasons for why a child is stunted, diet being one of them. But we know that stunting is a multi-causal circumstance of many things. Poor sanitation and hygiene, not exclusively breastfed, etc. There's many reasons, but to me, diet is really key in linking ag and nutrition.
Thank you. John is asking whether you can give us a bit more light on slide 33. I don't know which slide is that. Don't remember.
This one?
Probably. As he specifically said, yeah, 33.
Yeah, I mean, I think
yeah.
we can't really say what the impact of the Global Nutrition Report has had. Like, we know that it's highlighted gaps, different data gaps. we know that it's been used a lot. We know how many times the report's been downloaded, or how many country profiles have been downloaded, or how many times it's been cited, or a policymaker mentions it in a speech. But really, the question at the end of the day, when you think about the impact, is did the Global Nutrition Report spur action? So sometimes you'll hear, oh, the Global Nutrition Report, it was great because I put the country profile of Nigeria in front of the prime minister and he saw it. But the question is, well, did he do anything once he saw that? Did he increase his investments in the country to address stunting? Or did he institute a national mass media campaign to address exclusive breastfeeding? That we don't know. So the impact of the Global Nutrition Report, we know how many people are reading it. We know how many times it's mentioned. We know it draws a lot of attention. But do people act on that? They digest the data, but then do they use that data and make investments or change the way they behave or do something different? That we don't know. And so when you look at the slide, it's more of an advocacy tool, but what's done with that advocacy is a question that we don't totally know. Because at the end of the day, it's just a report, right? It's a report that gathers data, but what do you do with that data is really the key thing.
Yeah, that was great. Mary said Hadush has a question: in what combination level we feed children to say a child fed good nutritious food?
And what combination level we feed children to say a child? That's a good question. So when you look at diets, I mean, the diet of a young child should be one where in the first 6 months of life, a child is exclusively breastfed, right? But then it's the introduction of complementary foods, which are so key. And those complementary foods should be of adequate quantity. They should have adequate quality, so meaning nutrient-dense, diverse foods from vegetables, fruits, whole grains, cereals, dairy, animal proteins. And they should be safe, free from biological, chemical contaminants to reduce foodborne illnesses. And so one of those indicators, let me go back to that slide, this minimum acceptable diet, is looking at the proportion of children 6 to 23 months of age who received enough food, they got enough meals and calories, but that they also had an optimum dietary diversity or minimum dietary diversity. So so it's really about the quantity, the quality, and the safety of those foods. So the more diversity you have, the better. It's a proxy for diet quality.
Right. Thank you, Dr. Fanzo. I think I can also read Lilia's comment on your answer. I hope the diet data representing the link between agri and nutrition will be indeed more often used by agri community and policymakers, so that to get agri community more engaged and understanding the critical role agri plays in human nutrition. And about Biringero, actually you didn't, you lost your answer, but in this recording we will also have the question and answer part, so you can actually go back to the recording and listen to it just because of the time constraints. So I need to actually close the session, but it was great to have all these questions. So it was I think it was very lively question and answer part in the webinar. Dr. Jess Fanzo, I just would like to thank you again for your time today. This has been really, I think, inspiring. I learned a lot myself.
Great. Thank you, everybody. Thanks for joining.
Thank you. So I'll just close the session and we'll share the slides and the recordings as soon as possible. Thank you again.
Great.
Have a
Thanks,
great day.
everybody. Have a great week. Bye-bye.
Goodbye.